genetics then, when we're speaking about on the website and the videos, prevention, we're really speaking about prevention of the manifestation of the symptoms rather than prevention, maybe prevention of autoimmune, but prevention of symptoms rather than actual thyroid issues.
In fact, it's a very interesting question because you can't prevent genetic DNA, but the symptoms, and you can. We don't really want to wait until you go into puberty before the problems really flare up, right? We want to try and catch it earlier. So we say to all of our patients, once your children reach the age of 7, about the age of 7, the hormones, they change from a child into a little boy or little girl, right? In fact, I was talking to my daughter the other day with my 7-year-old grandson. She says, I'm sure I can smell BO on him. I said, yeah. I said, all his hormones are changing, right? But from the age of 7, if we can pick them up, the earlier we can pick up the child, I mean, this is hereditary, and put them into treatment, the better. So prevention is about treating the symptoms in the early stage of life. For instance, I can tell the average woman what happened to them when they went through puberty if I find that they have a thyroid condition. I tell them about the roller coaster they went through. I tell them about the cramping they had. I tell them about their menstrual problems that they had. I mean, they say, yes, yes, yes. And I said, that didn't have to happen, right? If we had caught you at a lot earlier age, it would have been smooth sailing all the way through, not only through puberty, but through the rest of your life. You didn't have to go on that crazy cycle. Boys even go through it, but it's on a slightly different scale. So the answer to that is the prevention is catching it early enough, not waiting until you're 40 or 50 and you have all these long-term illnesses, and especially as it may be going into autoimmune.
And the crazy thing is that when it comes to teenagehood, I mean, all those symptoms are just taken as granted. Oh, you're just going to get that. That's just what has to happen. It's a rite of passage almost. And you're like, wonderful, I get to go through all of this. Whereas, I mean, I was personally presenting with symptoms as soon as I came off breast milk. My weight just skyrocketed going off that, and so it's like the symptoms were always there. And so it's like saying, why do you have to wait? But we're not treating people, these supplements aren't for people under 7. We're waiting until you're saying
they are, but it's but we like to play it safe.
Yeah.